Hello everybody, Dr. Tom Fiala here, board certified plastic surgeon in Orlando. Today's reader mailbag question is, Dr. Fiala, can you explain the difference between liposuction and Coolsculpting? Well, sure. The procedures have several similarities and several differences. So they're similar in that they are both very effective at reducing fat that's immediately underneath the skin, the fat that we call subcutaneous fat, the stuff that you can pinch up when you feel your own tummy. And they're both for people that are relatively close to their ideal body weight. They are not, neither of them is going to help people drop a large amount of weight if you just look at the number on the scale. Okay? Liposuction is a surgical procedure. It can be done with general anesthesia, IV sedation, or sometimes local anesthesia only for very small areas. And it has a significant recovery time. There's swelling, there's some bruising, and it takes a while to see the final result. But liposuction allows us more flexibility with how we contour the area, and allows us to treat multiple areas during a one-day session. And for people that want a more dramatic result, liposuction is usually the way to go. Coolsculpting, on the other hand, is a relatively new FDA-approved technology that works by freezing the fat. And essentially, a fold of fat is drawn into the applicator head, and the fat is then basically reduced in temperature or chilled down to a level where the fat cells crystallize. But fortunately, it turns out that the skin at that temperature is undamaged, so there's no risk of frostbite. Okay? And after the fat has been chilled for about an hour, the cells inside have become crystallized, and the body then recognizes those crystallized cells as being damaged. And then the natural processes of cleanup, which is known as apoptosis, then kick in, and then over about 3 to 4 months, the fat deposits go away. So, Coolsculpting is very nice for people that have a very busy schedule, that they can't take the time off from their work to have a surgical recovery like we would with liposuction, or for people that are afraid of anesthesia, they can work. Cost-wise, the procedures are similar. Okay. Coolsculpting, because the area treated is only the size of the applicator head, to treat an entire abdomen or an entire circumference of the body may take multiple treatments, maybe 6 to 8 treatments to get it done. So it's more of a longer process. And also the results with Coolsculpting take about 3 to 4 months to show up. So it's a bit of a gradual thing. So they both can work, but one may be better for you than the other depending on what your goals and ability for time off are. Okay, thanks.